Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to be talking about barometric pressure changes and why that's a trigger for your headaches or migraines. This is something that is very, very common. I would say when I post something on social media, explaining barometric pressure and its connection to the neck or headaches and migraines, it gets lots and lots of attention, lots and lots of comments and likes and views. And so this is something I wanted to dedicate a podcast specifically to. Now, Denver, I believe, is the second, it's up there with the most dramatic and frequent pressure changes compared to any other city in the United States. I think Florida, or a few places in Florida, or just the state of Florida in general, might be number one. But Denver, Colorado, Colorado Springs, if you live in this area, you've probably come to realize that the pressure is changing frequently. So what you've noticed, likely, and even if you don't really realize that the barometric pressure changing impacts your situation, I can almost guarantee you that it does. Okay, so I'm talking to a good percentage of people with headaches and migraines that know that barometric pressure change is a trigger for them, but also just anyone with a headache or a migraine, having this as something you understand in your arsenal of things to address or be aware of as you continue on this journey of trying to figure this problem out. So what we're going to talk about are three different things. So we're going to discuss really why you would experience sinus pressure and what sinus pressure has to do with it, the Eustachian tubes, how the Eustachian tubes function and why that's important when it comes to pressure changes, and then also the internal pressure of joints. So we're going to talk about anatomy a little bit. We're going to get into the mechanics behind what is happening with pressure changes. I think this will be an interesting podcast. And researching it and coming up with some of the talking points for the podcast, I found it really helpful to match the clinical experience. So things that we are seeing be helpful for people with like ear fullness, ear pressure, ringing in the ears, obviously headaches and migraines triggered by barometric pressure changes, even like travel, flying on a plane, driving up to the mountains, going up in elevation. These things that cause pressure changes are very commonly triggers for people. And so understanding why our treatment, working on the neck, would help someone like that, and then putting it in podcast form, I think this is going to be really helpful. So again, this is weather changes. This is a cold front coming in. The barometric pressure drops with those clouds rolling in. It's winter, so snow, rain, obviously in the summer. So whenever that cold front comes in and you think, okay, well, maybe it's just because it's cold, maybe there's other factors. So likely it's the pressure dropping and your body having to respond to that. But then in addition to that, it's travel, flying on an airplane. So you go up to, I think they pressurize the cabin to about 7,000 feet elevation. And so if you live at sea level and then you fly, the plane might be at 10, but the oxygen and what it feels like inside the cabin's like 6 to 7. In Colorado Springs, I believe we're at like 6,000 or so feet elevation. And so living in Colorado, you have the impact of living at elevation, but travel can replicate this sort of barometric pressure drop. Traveling through the mountains, driving up in elevation as you go through a pass, or you're driving to ski or something like that. There's lots of different things that can kind of mimic the pressure change that someone would experience. But the big one is probably looking at the weather. The weather is something that, we can't control that. You can maybe control where you live, but most people are not going to move just to get away from pressure changes. So the pressure dropping and understanding what the impact on your body is important. So let's talk first about sinus pressure. We have a lot of people that present with sinus pressure as a component of their symptoms, or maybe that's the leading symptom is pressure, pain behind like their eye or in their cheek, what they'll describe as their sinuses. One caveat with that is it's not uncommon for that to be a referred pain. And so we've had many, many patients that go through ENT and maybe even like different procedures to try to clear out their sinuses because they feel like they have sinus pressure, but really it's a referral pattern. So the trigeminal nerve, this nerve that picks up sensation from the head or the face, meets up with other sensory inputs from the neck, and then our brain interprets what's happening. So neck problems can present as you having sinus pressure. And so that's where if you have a dominant presentation of sinus pressure and you have yet to figure out why that's happening, it very well could be that your neck or jaw is involved. Something else is triggering that signal. Now, you may also realize like that sinus pressure you feel is sensitive to the pressure changes, which may indicate that the sinuses themselves are not able to react or respond to the pressure change, which might have to do with congestion. So we know that there are some people that just have a resting level of congestion. This could be an airway issue. This could be breathing through your nose, like your inability to breathe through your nose. There could be physical things obstructing the sinuses from being able to allow the passage of air in and out of them. And so there could be physical obstructions, there could be congestion. Obviously, there's illness, so a virus or like a cold or the flu or something that's causing you to have congestion, and your sinuses aren't able to regulate air traveling through them, the passage of air, and so there's a pressure buildup in those sinuses related to congestion, whether that's from a temporary illness or something more long-term physical that's involved. And so the drop in, and this is a common thing that we're going to talk about, but the drop in the barometric pressure outside of the body makes a pressure gradient, leads to a pressure gradient. So the pressure inside of that cavity, of the sinus cavity, you'll feel that to a greater extent. It's going to be, your body's going to be even more sensitive to it. And so if you have headaches and migraines and you're congested and you're traveling, meaning you're flying on a plane, that's kind of a scenario, that's a bad scenario to be in because we'll talk about this, but the neck is connected to things like Eustachian tube function, and then you've got your sinuses, which are congested, so it's hard to regulate that pressure. And then you're traveling, and so when the pressure in the cabin changes, then your body's got to adapt to that. And all of those things can be really hard for your body to accommodate to. And so it's not uncommon for people to have a setback when they have a cold. And so it's not as if like the cold is a totally separate thing and that caused all the symptoms. The cold or whatever illness it was that your body was fighting off provided the congestion. The congestion is sort of sensitizing, make it hard to regulate the pressures, so that increased pressure is leading to a more sensitive or sort of irritated experience in those sinuses, which are traveling through that same pain pathway that your normal headaches or migraines travel through. And so it feels like maybe it's similar to your normal headache, maybe it's slightly different, but it's contributing to it. And so it's not as if like, so the idea is, if you were otherwise, like your neck was moving fine, your body was able to regulate these pressure changes fine, and you just had a cold, you may not have the headache as well. But because it's sort of all wrapped in this same nerve pathway and the same sort of, there's overlap in the neck problem and then the regulating pressure problem, and then you have a cold, it sort of impacts the whole thing, all right? So people having headaches when they're sick, it's not just an illness thing. Sometimes it's revealing things like neck issues that, were there in the first place. You just didn't really realize it. That's a little bit of a tangent, but that's sinus pressure. So that's the first thing that people would probably more naturally think about with pressure changes is the sinus pressure, and a couple reasons why that would impact your situation. And then we have eustachian tubes. So eustachian tubes are really, it's interesting to see the connection here, because if we understand the function of the eustachian tube and how it's impacted by something like neck or jaw tension, then we start to realize that things like ringing in the ears, ear fullness, ear pressure, even repeat like ear infections and bacteria buildup as a kid, these are things that point to the eustachian tubes being dysfunctional. And so when we ask, well, why are the eustachian tubes dysfunctional? We can answer that question through what I'll call the musculoskeletal system, so meaning muscles and tendons and joints and how the body moves. If that's disruptive, that can impact the function of the eustachian tube, the opening, the closing. So barometric pressure changes. The eustachian tube's function is to allow the middle ear, with like the eardrum, to it's sort of like a valve that relieves pressure. So like any sort of like mucus or liquid, it acts as a way of allowing the environment that the eardrum's in to not be prone to infection or bacteria. So it sort of clears out any of the buildup of mucus or liquid or things like that, and it drains basically into our throat. And so the eustachian tube is important to prevent those ear infections and then to allow the eardrum to be able to function properly, because it just sort of like responds to the air that passes through it, right? The sound waves. And so it's vibrating. And so if one side of the eardrum has more pressure on it because the eustachian tube isn't functioning well, then that eardrum won't be able to necessarily respond like it should. That's where like the ear ringing comes from, or the ear fullness, or the difficulty hearing. Okay, so the eustachian tube is important. When you have this eustachian tube that doesn't function well and the barometric pressure drops, you might see an increase in those symptoms. You might have the ear fullness or the ringing in the ears, but it may also lead to or be contributed to like your headache presentation, just something else irritated in this whole system that your body has to deal with. And so the main things that we associate with eustachian tube dysfunction as providers, so if you come in and you say you have ear fullness, ear ringing, or like the pressure changes really impact you, we're going to think, okay, there's probably something with the jaw going on, and definitely the neck. So we kind of have to look at the proximity of the neck and the jaw in relation to the sort of the valve aspect of the eustachian tube. So you've got the middle ear where the eardrum is, and then it's like this little tube that shoots into your throat. And at the end of that little tube, there are these muscles, 3 little tiny muscles that help to open and close the little sort of like valve of cartilage. And so like when you yawn, or when you open your mouth really wide, when you swallow, like there's a change in the eustachian tube. It allows that valve to open, and then some of the fluid or mucus enters into the throat, and then it clears, again, allowing the eardrum and the pressure in the eardrum to be regulated. Okay, so what's happening here when it's dysfunctional, this isn't exclusively the case, but this is most often what we find when people have neck or jaw issues. These little tiny muscles that help regulate that valve opening and closing, they're in close proximity and connected to parts of the jaw and the neck, the soft palate, so they have multiple functions. And when there's tension in the neck and in the jaw, it's going to impact things like the resting position or the resting tone, like how relaxed these muscles are in the soft palate. Swallowing in a lot of our patients looks different. If your head is resting in a forward position, if your tongue is tied, which we've talked about on this podcast, if your posture's off, if you have shoulder tension, like even something like swallowing is going to look different. And so all of these different muscles that make up your mouth and allow you to swallow, some of them are going to have to work harder. And so there's probably a sense of these little tiny eustachian tube muscles that open and close this little valve are carrying tension, just like the neck would and the jaw would, okay? And so we see neck dysfunction lead to the jaw being dysfunctional. I've got a podcast on that. Just search for the jaw. I forget what that podcast is called, but you can go back and search for when I talk about the connection between the upper part of the neck and the jaw. But neck dysfunction leads to the jaw being dysfunctional, so it'll kind of pull it in one direction. And then the jaw being dysfunctional is going to impact things like, like I said, like the soft palate, how we swallow, and these muscles then correlate to what that eustachian tube is doing, and if it's able to clear and regulate pressure like it should. All right, so just to summarize, eustachian tube regulates pressure so that the eardrum can function. It helps prevent bacteria from being built up, kind of clears the fluid. If the eustachian tube's not functioning properly, that's where you get ear fullness, ear ringing, repeated ear infections, things like that. The reason it may not be functioning properly is because of dysfunction, tension, leading to compensations and how you swallow and how you move in the upper neck and in the jaw. And so we find that there's evidence of this because we treat this all the time. People come to us with these symptoms. We work on their neck, we get their jaw functioning properly, and their ear ringing goes away or their ear fullness goes away. They're able to regulate pressure better. They can fly in a plane without having like the experience of their ear having to explode or their head needing to explode. And so we see this connection clinically. We look at the anatomy. We look at what we understand of the eustachian tube, and it all sort of blends together. Okay, the third thing is looking at the internal pressure of the joint. So when the barometric pressure drops, we see that the joint itself, just a little anatomy lesson, has fluid in it. It's called synovial fluid. And so a joint is made up of two bones that interact with each other. There's cartilage, which is kind of this smooth surface, allows it to glide, and then there's fluid. And that fluid is adapting to whatever it's asked to do. If it's asked to move quickly, it becomes more like viscous and fluid, and then if it's more sedentary or stationary, it sort of responds to that as well. The capsule around the joint that keeps the fluid in place is made up of ligaments. Those ligaments have some mobility to them, some stretch just slightly. They can be on slack and then they can be tightened. They usually don't have like the level of stretch that like maybe a muscle would. So it's not like there's a lot of elastic component to it, but it does hold the synovial fluid, the fluids in there, the cartilage. And so a healthy joint is able to regulate and balance all the movements and the pressure changes that are thrown at it. Now, if a joint is irritated, let's say it's like arthritic, that means the joint space has narrowed. So the cartilage is maybe impacted. Maybe there's a little bit of inflammation. Okay. So there's a couple things going on here. So the sensitivity in that joint, even before the barometric pressure change, might be higher. So the nerves are picking up some sort of sensation like, oh, there's some inflammation. It's a little irritated. And so when the barometric pressure drops and then the internal pressure within that joint increases, then the nervous system, that nerve picking up that signal is going to be more sensitive to that change. And so irritated joint's going to be more sensitive to changes. That's number one. Number two is just the pressure inside the joint itself is increasing. The barometric pressure outside drops, the pressure inside the joint increases, and when a joint is sort of irritated, it has a higher level of inflammation inside of it. So it already is starting with like a higher level of pressure inside the joint, and then the barometric pressure drops, which again just further increases the level of pressure irritation inside that joint. And so we've got a couple components here. When you think of someone that has arthritis in their knees or had a knee replacement, they can testify to this, that they always know when it's going to rain, when it's going to snow, because they can feel their joints stiffen up. So think of the neck. What we're talking about is like neck, jaw, shoulder tension. The joints in the neck have taken on a lot of stress. Typically, they don't move like they should. And the upper part of the neck, those joints send that pain signal to the head or the face. So this is what we're talking about with headaches and migraines. Now, those joints being irritated puts them in that category of, they're going to have a little bit of inflammation. So the internal pressure of the joint is going to be a little higher. They're going to be more sensitive to those changes. And so when the barometric pressure drops outside, that joint is going to feel it. And so whatever response or pain signal you were feeling before the pressure drops, you're going to feel it even more during. And you might be fine before the pressure drops, and then you feel the headache during, that doesn't mean that. So what does all this mean? This doesn't mean that there's nothing to do and you just have to like say, well, my neck is just tight, I have arthritis, and I'm just going to be victim to the pressure changes. No, absolutely not. So we can restore function to the joints. And when we restore function to the joints and we're moving better, that allows muscle tissue to have this more of a regular rhythm of contract and relax, instead of just being tight all the time. Okay. And so that allows the movement that's needed for a body to function well, which will result in proper eustachian tube function. So we're regulating pressure to allow our eardrum to function well, which means that we don't have that ear fullness or the ear ringing. Maybe we're not dizzy. I didn't mention that one. Dizzy is another thing that pops up with these pressure issues. It allows our sinuses to drain. Maybe there's less congestion. Maybe we're able to clear all of the mucus that's built up, because these physical barriers can cause what's naturally supposed to be like draining and preventing bacteria from building up and allowing us to breathe better. These physical barriers can be preventing that. And so just by moving better, clearing up the neck, jaw, and these different areas, allow us to regulate pressure better. Okay. So if we address the neck, if we address the jaw, if we start moving like we should, if we give our body the ability to function as it should, that's our way to combat this pressure change problem. And so we don't ever want to take something like pressure change and say, well, these are just pressure change headaches. There's nothing to do about them. I just have to avoid the pressure. You can't avoid pressure changes. And so you need to take action on correcting the neck problem, the jaw problem, getting yourself moving. If you want to do that, please reach out to us. We want to help you, whether it's virtually and you're, across the globe, or it's right here in Colorado Springs and you want to be in person. We want to be that place that helps you do that. We're trying to solve this problem. That's why I do this podcast every week. We appreciate you guys as listeners. Our website is www.noveraheadachecenter.com. Go on there. You can book online, or you can call us at 719-598-1010, and we'd love to hear from you. Please reach out if you have any other podcast ideas or things you want us to talk about here on the podcast. Thank you all so much for listening to the Headache Doctor podcast. As always, it's our mission to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.